Crisis theory. What is crisis? Crisis is taken from the Greek word krisis, meaning decision or turning point. Why is the definition important? This definition of the word as a decisive stage that has important consequences in the future of an individual or a system.
What does crisis theory do? It provides practitioners with a set of basic assumptions to guide decisions about whether to intervene, for whom, and in what ways. The basic assumptions are as follows. Individuals experience a state of acute emotional disequilibrium, social disorganization, cognitive impairment, and physical symptoms. Acute situational distress in a normative to life experience. Specific life event will be universally devastating. During a state of disequilibrium, individuals automatically strive to regain homeostasis or balance to their lives. What does crisis theory do? Continued. While attempting to regain homeostasis, the individual is psychologically vulnerable. The individual is amenable to psychological intervention. Crisis response is characterized by universal stages towards adaptive or maladaptive crisis intervention, and crisis affords an opportunity for growth and development as well as negative outcomes. Principles of crisis intervention. According to the textbook authors Carol Langer and Cynthia Leitz, when a person is in a state of crisis and is voluntarily seeking assistance, then intervention can occur. The principles for crisis intervention are 1. Crisis intervention is time-limited and short-term. 2. Engagement and assessment occur simultaneously and efficiently. 3. Meets concrete and emotional needs of the client. 4. Moves quickly and seeks to help the client to return to previous levels of functioning.
All right, next we're going to get into some examples of crisis theory. So crisis theory can be used in settings where there's a crisis or a traumatic event taking place, such as a natural disaster, hurricane, flood, earthquake, somebody who is in psychological stress, who is having feelings of helplessness, maybe anxiety, panic attacks, anything that will activate the fight or flight response. If somebody's under stress in general and they don't have healthy coping skills, they can live in a continuous cycle of stress, which would lead to increased psychological stress. Stressors and trauma vary from person to person. That's why it's so important for social workers to understand stress, trauma, crisis, and try not to minimize it for the person, because what they're going through at the time is very real and scary. So another profession besides social work that would use crisis theory and intervention would be law enforcement. Some cities have teams of CITs, which are crisis intervention teams, which are basically law officers who go out on crisis calls and trauma calls to help de-escalate situations. It's a great alternative to sending individuals who are having a health or mental health crisis to jail. So they go out and try to de-escalate. It's very short term. Sometimes social workers go with them to deal with the crisis trauma and provide additional resources.
We'll now talk about some limitations of crisis theory. So first, because crisis theory is designed to be implemented when our client is in crisis mode, it's likely to be accompanied by other resources, other interventions. So when everything settles down, it's really difficult to know if crisis theory was effective or what made the difference for our clients in that time. Second, crisis theory is meant to be temporary. These interventions aren't made to last for a long time. And so oftentimes if an issue persists or if it's recurring, other interventions will be needed for our clients. Professionals working with individuals who are experiencing crises and those professionals who need to use crisis interventions will need continuing education to ensure they're using best practice, such as safety planning and things like that. In addition, those professionals who are often implementing crisis theory or working with these clients will have a greater need to implement self-care to avoid burnout. We know that professionals who are on the front lines, as we say, or encountering these different issues will need to really focus on taking care of themselves so that they can work best with their clients. And lastly, during crisis intervention, it's likely that the social worker may do most of the work. Clients will be in crisis mode. They'll likely lean on their social worker. And after the crisis has subsided and things have settled down a little bit, they'll need to learn the skills and make lasting changes.
Strengths of crisis theory. Strengths. One of the strengths of crisis theory is that the models and protocols used in both assessment and intervention can be applied to different situations. It could be any situation that creates stress for an individual to the point that it affects them psychologically. For example, the theory can be applied to improving the quality of life of transplant patients. The theory presents an ideal framework that can lead to psychosocial interventions, which can help improve transplant patients' coping skills and quality of life. In continuation with strengths, another strength is that the crisis intervention model is effective when working with diverse families. The model produces positive outcomes with minimal time and cost, which can, for example, be helpful to an immigrant family with a small number of resources or limited resources. A third strength is that there's plenty of research validating the use of the theory in both assessment and intervention. Crisis intervention is an approach that has been widely used for many decades because of the beneficial changes that it can bring during the moment of crisis.